and vitamin and mineral supplements. Health risk factors such as asthma, obesity, ear infections, and sudden infant death syndrome, or SIDS, are lowered by exclusive breastfeeding for babies, and there's also benefits for the mothers as well by reducing the risk of high blood pressure, type 2 diabetes, and ovarian and breast cancers. Black mothers face disparities in breastfeeding after birth, preventing them from having the chance to initiate breastfeeding and continue beyond the first tries of initiation. Hospitals that primarily serve Black women do not offer feeding and lactation services to the mothers and immediately offer the mothers formula rather than a chance to initiate breastfeeding. There has been an increase in breastfeeding initiation, but a disparity for initiation and continuation remains among African American women. Some of the barriers that might keep Black mothers from initiating or continuing breastfeeding are lack of maternal access to information and support, language and literacy barriers, lifestyle choices such as tobacco and alcohol use, and lack of support or acceptance socially and also at their jobs. Doulas can play an integral role in starting and continuing breastfeeding in this population by bridging the gap in cultural differences, eliminating implicit bias, and intimately working with families. A doula is a labor assistant without formal clinical training but provides support physically and emotionally to an individual before, during, and after birth. Doulas can be trained through Doulas of North America or DONA to become a birth or postpartum doula. There's different training for each of those. And during slavery, they were referred to as granny midwives and helped the enslaved women and also their masters' wives. The significance of this project is to look at how doulas who are shown to positively impact birthing individuals but are underutilized, especially in a population who would benefit from them. Also, there's low numbers in breastfeeding for Black women, and the risk factors mentioned earlier can be minimized by breastfeeding, can also be helpful for Black women as well, and they're not just race or ethnicity dependent. My research question is, what is the impact doulas have on breastfeeding in Black women? This was looking at initiation and continuation of breastfeeding more specifically. Also, the impact could have been positive or negative or maybe even neutral. But from these articles, the general consensus is doulas are a positive influence on breastfeeding continuation and initiation. So now we're moving on to the methods section of this program. So this is my Prisma diagram from my methods section. And then this is where I went from finding 18 original articles when I did my initial search, and then I got down to 6, and then if you follow through the chart you can see where articles were taken out and the reasons to get down to the 6 from the 3 research databases that I used. The population evaluated is African American women and birthing individuals in the United States during the 21st century. Several databases were included in the search, such as PubMed, I think it's called CINHAL, it's CINHAL, which is on the screen, and then Embase, and then Boolean terms and controlled vocabulary were used within each database search. The 3 concepts identified were Black women, community-trained doulas, and breastfeeding. Articles were included in the review if they were published between 2000 and 2023, included Black women. They were written in English, took place in the United States, and had the presence of a doula and reported the outcomes of breastfeeding duration and initiation. I also use Zotero as my bibliography and citation generator, and also Jess King, UNMC's library liaison, also helped with my search as well. So here is the table of my results. There were 6 articles that I reviewed. It is organized by author, title, study design, and or method, and themes found in the article. I'll give you a few moments to look that over and really digest some of the titles because they were quite interesting reads. And despite not having many articles, they provided a lot of insight for me and information on the relationship between doulas, breastfeeding, and Black individuals. So 6 journal articles were reviewed for this literature review. The first one was Dougal et al. Outlined a qualitative pilot study of 20 African American women. The next was Kalia Ramey Collier et al. Was a literature review of a doula care and its impact on the birth experience. Cosmanel et al. Was a cross-sectional study that found African American women supported by a doula and almost had a 92.7% breastfeeding initiation. Furman et al. Conducted a community-based participatory research study that analyzed culturally appropriate breastfeeding education and doula support in Cleveland. Edwards et al. Studied home visiting by doulas for young African American mothers. They were under 22 years of age in a randomized control trial, and Lewis-Jacks was another qualitative research study that provided a unique viewpoint from the perspective of doulas who serve. The first result I'm going to discuss is breastfeeding initiation. Breastfeeding can be an easy journey for some mothers, but unfortunately, it can be a hard journey for others. Finding from the articles indicate doulas are a great resource for mothers and help them tackle both mental and physical roadblocks. Some common roadblocks expressed by mothers and doulas were women's perception of infant preferences for formula and fears of creating infant dependency on breastfeeding mothers, and sometimes they use the word spoiling as what some mothers would refer to as their infant being dependent on them. Structural constraints that necessitate returning to work soon after childbirth, lack of proper peer support systems to model successful breastfeeding and provide advice to overcome problems. A study found that women who had a doula and were receiving Medicaid had a 17.1 higher initiation rate than any other Medicaid-covered woman without a doula. The African American initiation rate was 22.4% higher than the rest of Medicaid. In the discussion, the authors highlight that having a culturally trained doula can help diminish income and racial or ethnic disparities and make universal breastfeeding initiation attainable. Ramey Collier et al. Echoes the improved outcome of breastfeeding initiation and continuation with support from a doula and a birthing woman. This study also looked at proper car seat use and placing a baby on back to sleep, which are also just as beneficial to a baby's health as breastfeeding is. Edwards et al. Studied home visiting by doulas for young African American mothers. Low breastfeeding rates are prevalent in very young mothers. They looked at mothers under the age of 22 for this study. And then unfortunately, it is uncommon for this demographic to introduce complementary foods too early, where the doula home visiting plan assists in continuing breastfeeding and proper introducing these solid foods. And then complementary foods could be like baby food or starting other solid foods, like using the baby-led weaning method. Doulas saw moms starting during pregnancy up until 3 months postpartum during this program, and having a doula present helped these women adhere to breastfeeding and introduce them to solid food guidelines. Next, I'm going to discuss breastfeeding continuation. There was not much research conducted on continuation after 6 months of age, and the CDC recommends up to 6 months, but we know that some women choose to continue beyond 6 months of age. More research needs to be conducted on this aspect of continuation. And then from one of the studies, Lewis-Jacks et al., one doula stated that her clients would continue to breastfeed because of the information given to them on the importance of breastfeeding, the consistent encouragement from herself, and troubleshooting techniques when mothers reached a roadblock in their breastfeeding continuation. The doula's lactation education also played an integral role in breastfeeding initiation and maintenance among this population, despite the perceived roadblocks. A study in this article, also by Ramey Collier et al., was a prospective cohort study, found that doula-assisted care led to 89% of women breastfeeding 6 weeks postpartum versus only 40% of women who received standard care without a doula. And then I did my quality assessment for each article, and that was conducted using JBI tools, which is the Joanna Briggs Institute, and that correlated to each study design. These tools provided checklists and an explanation as to what should be included in the study on the type of design it was. I went through each study with a checklist and was able to check off or discover that an article was missing certain aspects. Overall, the studies and one review used this literature review were outstanding and provided great information and resources pertaining to the literature review topic that I was looking at. But there still needs to be more research conducted on continuation after 6 months of age. This literature review was conducted to explore the impact of doulas on breastfeeding initiation and continuation. A strength of the study was exploring the Black population, but could also be seen as a limitation, as findings may not be able to fit to other races and ethnicities. Only looking at this demographic was also mentioned as a limitation in some of the studies performed, and they also indicated their findings might not be applicable to other populations as well, so there's a need for more research to be done there. Another limitation for this study is the number of studies found to review and the use of only 3 search engines. Some other strengths of my review are that it is reproducible by other researchers and is precise in stating the outcomes and the impact of breastfeeding initiation and continuation on Black women. An implication for future research is to study other racial and ethnic groups to see if results and conclusions carry over regarding the positive impact doulas have on breastfeeding, and determining if the results and conclusions are applicable to other populations as well. There also should be more studies on a wider range of socioeconomic groups rather than primarily low-income Black women, to also see if results and conclusions are applicable to them. Doulas are significantly underutilized, especially by populations who would benefit from them the most based on research found in this study, and suggested policy change would be to have doula care covered by insurance, whether it be a private employer or by Medicaid. Doulas can cost us a significant out-of-pocket amount, making them unattainable to a large population of women, but they provide such a positive impact during prenatal, birth, and postpartum period. They should be made more attainable for all populations, not just the ones that can afford them. Thank you very much.
Wow. That is a lot of information. What we'll do now is go ahead and kind of open it up to anyone that has questions that they'd like to ask Delaney about her presentation. So you can go ahead and unmute and ask away.
Must be thoroughly covered.
Or maybe there's no questions.
It's not looking like it. Okay. Well, then I will thank all of you for coming and being part of Delaney's presentation, and supporting her through this aspect of the program. And we're going to go ahead and close the rest of the meeting. And thank you again.